Spinal immobilization begins with manual immobilization of the cervical spine and continues with application of a cervical collar. The cervical collar supports the head and neck, maintains neutral alignment of the cervical spine, and reminds the patient to keep from moving his or her head and neck. Spinal immobilization is not complete until the patient is secured to a spine board with the cervical collar in place. Spinal immobilization should be considered anytime a patient sustains a significant mechanism of injury, complains of head, neck, or back pain, suffers soft tissue damage to the head, face, or neck from trauma, or exhibits an altered level of consciousness without explanation. Take BSI precautions. Approach the patient from his or her front. This will discourage the patient from turning his or her head to look at you, compromising the neck and spine. As you walk toward the patient, introduce yourself and instruct him or her not to move. You or your partner will maintain manual cervical stabilization with one hand on either side of the patient's head and neck. Applying a cervical collar can be uncomfortable for the patient, so be sure to explain why the patient needs a cervical collar and the steps involved in the procedure. Before starting, get the patient's consent to apply the collar. With manual immobilization maintained, perform an evaluation. Evaluate pulses, motor function and sensation, PMS, in each extremity. To do this, palpate radial and pedal pulses, assess grip strength as well as flexion and extension of the feet, and touch the patient's extremities to determine perceived sensation. Determine the proper size of the cervical collar by measuring the distance between the patient's trapezius muscle and angle of his or her jaw. Use your finger width as a guide. Correlate this distance to the distance on the cervical collar between the bottom of the rigid plastic and the sizing post or hole. Do not include the soft foam in your finger width measurement of the collar. The foam provides no support and will compress when positioned around the patient's neck. Be sure to select the proper sized collar. If the proper sized collar is not available, it is better to place a rolled towel around the neck to remind the patient not to move his or her head, and tape the patient's head to the board with head blocks in place. Be sure to inspect and palpate the cervical vertebrae for pain, tenderness, warmth, crepitation, or deformity, which can all be indications of a cervical spine injury. Once the collar is in place, it will be difficult to assess the neck without removing the collar. For supine patients, slide the back of the collar in place under the head and neck, then wrap the front of the collar around the neck until it sits in place. This method avoids pulling a patient's hair. Next, wrap the collar around the back of the neck, securing it in place. You may need to remove earrings, necklaces, hoods, and collars before application of the cervical collar to prevent further injury and to ensure neutral alignment of the head. Lift the patient's hair out of the way during application of the collar. For seated patients, slide the collar up the sternum until it is in position under the jaw. Then, wrap and secure. Assure that the collar is fitted and applied properly. The collar should not hyperextend the neck or fit so snugly that it constricts the airway. Maintain manual cervical stabilization until the patient is secured to a spine board. Reassess the patient's pulses, motor function and sensation, PMS, in all four extremities, noting any changes from your initial assessment.